إيه الآن واضحة،
الآن واضحة؟
بس جرب تحرك تكسر إذا تغير. إيه كويس تمام.
طيب. We will talk about cell count peripheral blood smear examinations. مهم جدا تركزون في شيء مطلوب في المحاضرة هذه وفي شيء an extra for knowledge ما هو مطلوب معكم في الإكزام، فيجب أنك تعرفون الشيء هذا ما هو بكلها، لأنه في objectives وفي أشياء وجدتها موجودة ما أعرف وش الهدف منها، لكنه في أشياء مهمة جدا طالب الطب يعرفها وهو يخلص كل الطب تكون basic things، لكنه في أشياء details ما هو مطلوب منكم، فأنا بالتالي راح إذا تبغوني أتكلم فيها بالعموم كامل المحاضرة ما عندي مشكلة، تقولون لا الأشياء for reading keep it، لكن أنا أفضل إني أمر عليها سريع وبقول لكم الشيء اللي for reading والأشياء اللي تكون داخلة معانا حقول لكم عليها. كلام واضح؟ So أنا بلشان بذي CBC we automated differential. Each patient when you request a CBC usually have to look at first to the age, gender, very important. Then you have to look at for white blood count, hemoglobin, platelets. Platelets 344, hemoglobin 13.5, white blood count 5.1. Then you have to look at for the differential. طبعا we have two types of differential. في automated differential وفي manual differential. manual differential الباثولوجيست او الهيماتوباثولوجيست تحت الميكروسكوب يعدهم manual differential، والautomated هو machine counted. فانت once we have it look at the white blood count, الهيموجلوبين والplatelets. قلنا after الهيموجلوبين you have to look it for MCV plus يعني very important MCV to know exactly. MCV هنا 87.3 so it's normocytic. لكن you have to keep your eyes on hematocrit والMCHC والMCH in addition to the RDW. لكن الMCV was very important. Then you have to go to the differential for white blood count اللي هو النيوتروفيل, lymphocytes, monocyte, eosinophil والبيزوفيل. Usually we'll go with percentage. Finally في comment الباثولوجيست يكتب comment إذا normal إذا abnormal either في الautomated أو في المانوال يكتب لك مثلا neutrophils include segmented and bands forms. يكتب لك إذا if there is any abnormal cells looks like إنه might be a leukemia. هو ما حيقول لك leukemic cells لكنه حيقول لك abnormal cells. مهم جدا دائما في الكومنت you have to look at both الautomated أو المانوال إذا في any abnormal comment من الباثولوجيست about CBC. Again, stem cells, this is how it's started for erythrocytes. It comes through the stem cells, hemocytoblast, then proerythroblast, then this is the early phase, early erythroblast with late nucleus, with normaloblast, then reticulocytes if you see destruction or distribution of the nucleus, then finally erythrocytes. This is the stages for erythrocytes. غير مطالبين بحفظ الأسماء هذه. Rule of peripheral blood examination. Reason to evaluate for anemia, any thrombocytosis or thrombocytopenia, any abnormal cells appears on the peripheral smear, blast, or any abnormal promyelocytes or atypical lymphocytes, infection like malaria, any inclusions like basophilic stippling, whole jelly bodies. So you have to look it for a peripheral blood examination. For evaluation, pancytopenia in general. غير مطالبين بالبريفرال سمير preparations. كل الكلام هذا كله for extra informations or reading. Objectives البريفرال blood smear, peripheral smear preparations, staining و-examinations. بس تعرفوا الخطوات how we can locate for a peripheral blood smear. Specimen, usually through edit anticoagulated blood, should be made within 1 hour of blood collection from the edit specimen. Should be stored at room temperature to avoid distortion of the red cell or cell morphology. Blood smears can also be taken from finger prick blood directly onto the slide directly, or ممكن through the blood vessel when you collected the blood. Could be كمان during the bone marrow aspiration we can take it as sample. لأنه during the bone marrow aspirations في aspiration اللي هو for liquid part وفي biopsy اللي هو البوني pieces. So you can do it specimen through these 3 things. This is how smear preparations. The drop of blood, then the sliding these drop the whole slides. This is steps how to prepare smears for reading. طبعا مهم جدا تعرف إنه there is a head or there is a tail for a blood film. Film to be thick here or thin, very thin here, but in the middle usually it's an ideal thickness. This is an area of interest to look at for lymphocytes or any abnormal cells. Usually they prefer in the middle, not too thick, not too thin of peripheral blood smears. This is how it looks like the shape of blood film. You can see it different blood films here. It's vacuoles. This is not well prepared. This is too thick. Vacuoles again here. The different shapes. فمهم جدا إنه very important when you do it smears. خصوصا mainly هم الباثولوجيsts. They do it in a proper technique. Slide fixation staining. This is a different staining to be used during the peripheral blood smear. The most important of them اللي هو right stain. لكن others it can be Romanesque staining. It's common category. الميثودولوجي غير مطالبين فيه. اللي يبغى يقرأ ويستفيد منه مهم جدا. later on لو واحد حابب يفكر في الهيماتوباثولوجيست ولا الهيماتولوجي تكون عنده concept about how the peripheral blood smear preparations. The color response of blood cell for the staining, usually a nucleoli تكون light blue والnucleus usually chromatin يكون purple color. الcytoplasm depends. إذا كانت الإريثروبلاست dark blue في الإريثروسايتس usually dark pink وفي الريتكس count usually gray blue. دائما الريتكس counts زي ما قلت لكم الريتكس أو الريتيكولوسايت دائما تكون polychromasia. هذا الاسم جاي من purple color هو ما بين الجراي والبلو. الإريثروسايت usually dark pink cytoplasm والإريثروبلاست usually تكون dark blue. غير مطالبين بحفظ الألوان بس مهم جدا تعرفون إنه this is a different colors for each one. الجرانيولز basophilic eosinophil neutrophil toxic granules platelets هي تعتمد أكثر على adaptation of your eyes. When you look at more for frequent slides you can pick up this is a lymphocyte, this is a monocyte, this is a neutrophil, this is a basophil, this is a toxic granules. فكل ما تشوف أكثر كل ما يكون في معرفة أكثر. طبعاً في EU roots في hologeal bodies في dual bodies. A lot of inclusions غير مطالبين بحفظ الأسماء هذه الآن حتى أقول لكم ركزوا معي فيها. Peripheral blood smear الماكروسكوبيك view مهم جدا إنه there is no abnormal particles present to avoid any mistake of reading of peripheral blood smear. Usually microscopic analysis to be start with the lower power. Assess the quality of preparations. Assess whether red cell agglutination, excessive Frolux formations, or platelet segregation is present. Assess the number of distribution or staining of leukocytes, very important. Then you have to find area where the red cells are very distributed in a nice way, are not distorted. Usually in the middle, in between, it's not toward the thick area or a thin area. This is on the lower powers. On the high powers, you have to obtain it for a white blood cell estimate and analysis. And there is oil, it's called oil immersion. We can use it to get more easier looking for details of white blood counts. This is how it looks like normal peripheral blood smear. Normal distribution of of red blood cells. There is a space in between each others, so it's normal distribution of red blood cells. There is no polychromasia. There is a few platelets distributed, if you can see it, and also leukocyte. This is a lymphocyte, and this is segmented neutrophils. You can see it, segmented neutrophils. This is called the stomatocytes. Sometimes signs هذه لو تشوفوها looks like a lips. It's called stomatocytes. Might be we cross over later. Area to examine. This is how it looks like the slides when you put it under the microscope to see a thin area. It looks like a wider space between the red blood cells and difficult to estimate the red blood cells. This is how it looks like when you are doing under microscope focus on the thick area. When you see it under the focus under thick area, it looks like agglutinations or Rolex formations. Difficult. You cannot estimate. You can see it like a coins sticky to each other. But this is how it looks like on the thick area. You have to focus on the middle and on the nice way when you are looking for the white for red blood cells and white blood count. Okay. Evaluation of peripheral blood smear. You have to start with the red blood cells. When you are looking for red blood cell, you have to look it for size, shape, color, arrangement, inclusions. White blood count, you have to look it for white blood count, differential counts, abnormal white blood count, shape, platelets, counts, and abnormality. طبعا when you are looking under microscope, you have to have some idea in this is a patient مثلا 35 with hemoglobin 9, white blood count 7 and platelets 235. حتى تعرف انت وين ماشي انه والله this is anemic patient, so you have to focus on the red blood cell first. طبعا احنا مطالبين من هنا نبدا نركز. ها واضح الكلام؟
اي واضح.
Hypochromic, you can look at decrease the hemoglobin content of red blood cells. You can see it. This is a hypochromia. You can see it, the difference between the white area and the red area. The white, it's more wider than and more larger than the red area. This goes with the hypochromia. This is the lymphocytes. This is the different platelets. It could be a bands or could be an early segmentations for white blood count. Usually hypochromia, there is increase in the central pallor more than 1/3. So we mean by the increased central pallor, this is central pallors, it's increased more than 1/3 of a total of the red blood cell. Usually hypochromia associated with decreased MCHL, MCHC, mainly common to be seen في iron deficiency anemia وثلاسيميا. وتكلمنا أمس على المicrocytic anemia in abbreviation called TICS. Hyperchromia. Red cell usually it's stained deeply, different from the other one. Central pallors, it's less likely to appear here. increase في ال MCH usually seen في الميجالوبلاستيك انيميا، وتكلمنا عن الميجالوبلاستيك انيميا، الفوليت deficiency، الفيتامين B12 deficiency، والنون ميجالوبلاستويد اللي هو liver disease وثيروتوكسيكوزيس والكحوليزم، وأيضا مع reticulocytosis you can see it. أيضا you can see it hyperchromia مع hereditary spherocytosis. They have normal MCH و abnormal MCHC. تكلمنا أمس عن الانيسوسيتوزس، هي نفسها الانيسوكروميا presence of hypochromic cells and normochromic cells in the same film. Anisochromia, anisocytosis from the size, والchromia it's from the color. The anisochromia, presence of hypochromic cells with normochromic cells in the same films, also called its dimorphic anemia. We have a two population of cells seen في sideroblastic anemia. Sometimes you can see it a few weeks after iron therapy for iron deficiency anemia. أيضا after blood transfusion for any person who received a recent blood transfusion, you can see it hypochromic anemia after transfusion with the normal cells. This is how it looks like in dimorphic blood pictures. You can see it as some normal cells and hypochromic cells. واضحة. This is a hypochromic cells and this is the normal cells. This is dimorphic blood pictures. Polychromatophilia, here another name called polychromasia. Well, polychromasia, it just only reflects the reticulocytes. احنا قلنا الريتيكولوسايتس تكون dark blue قبل ما تكون red blood cells. This is the reticulocytes. تكون polychromasia. When you see the reticulocytes على البريفرال smear, the name is different, called polychromasia. This is the polychromasia. It's a blue-gray tint of red cells due to hemoglobin and the RNA residual in the young cells. Larger than normal and may lack a central pallor. It implies a reticulocytosis seen mainly إذا كان في hemolysis، إذا كان في acute blood loss، لأنه bone marrow try to compensate the hemolysis. There is premature cells appearing in the peripheral circulation. This is a polychromasia and acute blood loss. واحد فاتح المايك يا شباب. تسمعوني؟
ايه نسمعك.
ايوه دكتور.
في واحد فاتح المايك ما أعرف منه. Okay. Variation في السايز، قلنا في anisocytosis هو variation في size of red blood cells. If we have a normal MCV, usually between 80 and 100, microsize MCV less than 80, and macrosize more than 100. Anisocytosis is usually a feature of most anemias. Most of the anemia you can find it anisocytosis present. This is another pictures, microcytosis. واضح الميكروسيتوزس؟ واضح الميكروسيتوزس؟
ايوه واضح دكتور.
فقط هو مشاري اللي جالس يرد علي اليوم. طيب. Macrocytes, you can see it في المacrocytes, hyper segmented neutrophil. This is how it looks like macrocytes. Variation in the shape, it's called poikilocytosis. Shapes could be elliptocytosis، وهذا الاسم اللي تكلمنا عليه elliptocytosis. في شيء اسمه hereditary elliptocytosis. Spherocytosis أيضا في hereditary spherocytosis. Target cell schistocytes اللي هو تكلمنا عليها أمس، قلنا microangiopathic hemolytic anemia. Acanthocytes, keratocytes, echinocytes, white cell, helmet cell, a lot of names للshapes for red blood cells. في أشياء مهمة حتمر علينا ركزوا عليها. this is how it looks like الليبتوسيتوز. طبعا قلنا في شيء اسمه stomatocytes. هنا الليبتوسيتوزس elliptical in shapes common في الهيريديتري الليبتوسيتوزس من الاسم الليبتوسيتوزس. It can be seen في الايرون deficiency anemia، في المايلوفايبروسيس والمايلويد ميتابليزيا والسيكل سيل انيميا والميجالوبلاستيك انيميا، لكن the famous one it's with hereditary elliptocytosis. غير مطالبين بحفظ اسماء كثيره، بمعنى غير مطالبين انك تحفظ الليبتوسيتوزس. لو بجيب لك سؤال mentioned two differential diagnosis الليبتوسيتوز، hereditary elliptocytosis مهم جدا انك تذكرها وتحفظ اسم اخر معاه، iron deficiency anemia or sickle cell anemia whatever، لكن الصوره مهم جدا تعرف this is elliptocytosis. Spherocytes من النيم it's oval shape, it's almost spherical in shape, diameter smaller than normal. هنا ما هي واضحه معي حقيقه في الباوربوينت، لكن usually diameter this is how it looks like. Diameter is smaller than normal. This is a normal, this is abnormal. This is spherical shape. Darker, lack central pillars. There is no central pillars. Smaller, eccentric pale area. Sometimes يكون في eccentric pale area تكون في الطرف eccentric. Commonly في الهيموليسيس spherocytes. في الهيريديتري من اسمها hereditary spherocytes. والautoimmune hemolytic anemia. والdirect physical or chemical injury اللي هو البيرز. Plus it can be seen also في acute blood loss اللي هو GI bleeding. إذا the spherocytes it can be seen with the hereditary spherocytes, hemolytic anemia, with direct physical or chemical injury like thermal injury burns. يكون عندهم microspherocytes في البير والacute blood loss. طبعا غير مطالبين بحفظ الشيب، اشكال الشيب، lack central pale area have small، لكنه مهم جدا تعرف. انا جالس اشرح لك على السلايد، فمهم جدا تعرف لي اهم شيء عندي. تعرف لما يجيك اي اكزام في اوسكي ولا وات ايفر ولا اوسبي يجيك صوره، عارف انك قادر انك you pick up what you have differential diagnosis. وش الصوره هذه اللي امامك؟ هل هي سفيروسايتس؟ هل هي الليبتوسايتس؟ هل هي كانثوسايتوزس؟ هل هي sickling؟ هل هي schistocytes؟ ف very important. Target cells, cell in which central round stain area and peripheral rim of cytoplasm. If you can see it, this is the target cells. This is the target cells. يكون في pale في السنترال with the dots in between. Seen mainly في الثلاسيميا common, في الكرونيك liver disease common, hereditary hypo-beta lipoproteinemia, في الايرون deficiency anemia, في السيكل سيل anemia, في البوست splenectomy. The target cell is common to be seen with the liver disease, with sickle cell anemia, with iron deficiency, with thalassemia. Schistocytes, fragmented red blood cells, different shapes, biot cells here. This is a biot cells, different shapes. It's a fragmented erythrocytes, smaller than normal red cells, and they have a varying shape. It could be seen with a genetic disorder like thalassemia, with congenital erythropoietic anemia, mechanical stress like MAHA. وراح نتطرق لمها شوية، راح يكون في سلايدات على MAHA اللي هو microangiopathic hemolytic anemia with a direct thermal injury كمان في البيرنز you can see it. Schistocytes common differential diagnosis لو انسألت فيه هو TTP HUS. طبعا كلها belong to MAHA. MAHA it's a big category called microangiopathic hemolytic anemia، لكنه TTP وال HUS هي top two differential diagnoses. لما تشوف schistocytes you have to think about these two differential. أيضا إذا كان مريض عنده cardiac valves sometimes إذا كان عندهم leaking في cardiac valves في aortic mainly ممكن يحمل لهم schistocytes في preeclampsia والeclampsia, burns, thermal injury, a lot of differential medication الكوينين، لكن أنت غير مطالب بحفظ هذه كلها. لو قلت لي 1 ولا 2 TTP HUS enough. Acanthocytes, red cell with a small number of speckles of inconstant length. It's different length, mainly thick في shape irregular, disposed over the whole surface. C mainly مع الphospholipid metabolism خصوصا في الابيتا lipoproteinemia, inherited abnormalities of red cell membrane proteins. Post splenectomy, you can see it acanthocytes. This is acanthocytes, 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 acanthocytes. Echinocytes, more sharper. It's usually called crenated cells, numerous, short, not thicker like the previous one, regular projections. Commonly, it can occur after artifacts during the preparation for the fill. المريض يكون DKA hyperosmolarity يكون عندهم premature infant after exchange transfusions. You can see it echinocytes. Keratocytes have a pairs of speckles, either one or two pairs. You can see it keratocytes here. Other name, we can call it a bite cells. This is keratocytes. Sometimes a bite cells or a helmet cell seen in a mechanical damage, removal of Heinz body by petting action of spleen. You can see this is a bite cells or keratocytes. واضحة؟ Stomatocytes, red cells with a central biconcave area appear slit-like tried film. Wet film, it's appear as a cup shape. When you see it like a cup shape, artifact, it could be ovalocytosis, في south وeast وasian ovalocytosis, liver disease, alcoholism, MDS اللي هو myelodysplastic syndrome. The commonest things اللي هو liver disease والalcoholism. What do you think هنا؟
صار في سؤال على الصورة اللي قبل تسمح.
Go ahead.
صورة مثل هذه الحين كيف أعرف هل هي ماكروسيتيك ولا ماكروسيتيك ولا نورموسيتيك؟
الصورة اللي أمامك؟
إيه.
What do you think أنت الآن؟
ما أدري يعني يمكن أقرب الصورة من بعد فما أقدر أحكم.
ما تقدر تحكم. إذا أنا ما راح أسألك في السؤال هذا إن هل هي ماكروسيتيك ولا مايكروسيتيك. حسألك على الشيء for red blood cells here.
طيب متى أقدر أحكم هل هي ماكرو ولا مايكرو؟ لازم يكون في ليمفوسايت مثلا؟
لا، غير مطالب. أولا يجب تعرف الميكرو والماكرو والنورموسيتيك related للريد بلاد سيل، فما لك علاقة بالليمفوسايتس. معي في الكلام؟ لكن انت you need الميكروسكوب to focus على whole area. تحرك الميكروسكوب وتشوف different. أنا أقدر أقول لك هذه أنت what do you think هنا في الريد بلاد سيلز؟
نورموسيتيك.
It could be normocytic. ولو قلت لي أيضا ماكرو سيتوز مش ماكرو سيتوز ممكن أكون أجري معك، لكنه most likely أنها تكون نورمال لأنه ما في سنترال بالر اللي هو المايكرو سيتوز. لكن أنا ما راح أسألك السؤال هذا العبيط، لأنه أنا إذا بجيبها بتكلم عن الشيب.
تمام.
أنا بتكلم عن الشيب هنا، ما بتكلم على السايز. تكلمنا على السايز في البداية الانيسوسيتوزس، الآن إحنا نتكلم عن البوكيلوسيتوزس اللي هو الشيب for red blood cells. فأنت حتشوف السايز أكثر إذا كان معك ميكروسكوب وتحركه يمين يسار تقدر تشوف. إذا كانت صورة زي كذا ما حقدر أسألك عليها، صعب إني أقدر أسأل طالب طب إنه this is a micro ولا macrocytic. سؤالي حيكون واضح إنه حتكلم عن الستوماتوسايتس هنا.
إيه تمام، شكرا لك.
طيب. What do you think هنا؟ من اللي سألني السؤال؟ من اللي سألني أولا؟ من سأل؟
أنا دكتور.
اللي سأل منهم، بس عرفني باسمك.
أنس رشيد.
أنس رشيد. Can you comment about this slide?
في كريسنت RBC.
اوكي.
في بعضها فيها بايت سيل. في تارجت سيل.
في تارجت سيل هنا صح؟
إيه.
طيب. وكل هذه وهذه ما عجبتك شيء؟
هذه قلت لك كريسنت.
What do you think؟ ايش الديفرنشال تبعك؟
ممكن سيكلر تكون كذا.
سيكلر تكون كده صحيح. سيكلر this is could be سيكلرز. سيكلر يكون بالشكل هذا. This is the target cells. احنا قلنا target cell ممكن يكون في السيكل سيل انيميا صح ولا لا؟
صحيح.
This is the sicklers. Teardrop cells, another name, it's called teardrop cells. Common things you can see it. One side of the cell is tapered and the other will be blunt. How it looks like, this is a tear. واضح teardrops. Usually commonest example هو myelofibrosis or primary myelofibrosis. Also you can see it with thalassemia, hemoglobin H disease في iron deficiency. Okay, we finish from poikilocytosis. Then we have to go to the inclusions. Red blood cell inclusions. We have a whole jolly bodies, basophilic stippling, Bebenheimer's body, Heinz body, crystal, caput rings, nucleus. طبعا غير مطالبين بحفظ الاسماء هذه او الكونتنت ايش هي، بس مهم للمعرفه انك تعرف انه هولي جول بوديز هي دي ان اي ريمننت، البيزوفيليك هي ار ان اي، البيبنهايمرز بودي هو الايرون، الهاينز بودي هو دي نيتشرز هيموجلوبين، الكريستال لايك هيموجلوبين سي، الكابوت رينجز هي ميتوتيك سبندل ريمننتس، والنيوكليوس هو الدي ان اي. نبدا basophilic stipplings. Presence of regular basophilic granules with red blood cells which are variable in size. This is basophilic stipplings. Stain deep blue with right stain. It could be a fine or coarse. The commonest things you can see at the basophilic stippling هو lead poisoning with heavy metal poisoning. You can see it with megaloblastic anemia, thalassemia, infection, liver disease, and stable hemoglobin. لكن this is an example for basophilic stipplings. أنا ما راح أسألك في الديتيلز content how it looks like، لكن ممكن أسألك give me a different، ممكن أسألك عن basophilic stippling إذا جبت لي lead poisoning it's enough، megaloblastic anemia it's enough. What do you think? Smooth
هاو
single.
الجولي بادي دكتور؟
طيب smooth single large round inclusions which are a remnant for nuclear chromatin seen either single في الميجالوبلاستيك انيميا والهيمولوجيك انيميا والبوست سبلينكتومي تكلمنا امس عليها، وcould be تكون multiple either we can see it with megaloblastic anemia والابنورمال erythrocytosis. من اللي قال whole jelly bodies؟
انا عبد الله دكتور.
عبد الله مين؟
عبد الله الحباش.
whole jelly bodies ها common post splenectomy وفي الهيمولوجيك انيميا we can see it ايضا في السيكل سيل انيميا في الاوتوسبلينكتومي. Oppenheimer's body هو iron content. These are small single or multiple peripherally. Usually it's Oppenheimer's تكون peripherally. Dots basophilic. Once we say that it's basophilic means it's a blue colors or dark blue. It's erythrocyte inclusion. Smaller than the whole jolly bodies. The whole jolly bodies usually تكون central. هنا حتكون usually في peripheral. Composed of hemosiderin or iron content. You can see it with the sideroblastic erythropoiesis, hyposplenism, myelodysplastic syndrome, or hemolytic anemia. You can see it in the peripheral. This is how it looks like Oppenheimer's bodies. Heinz bodies seen on the supravital stains, blue or purple, large single or multiple inclusions attached to the inner surface of red blood cells represent precipitated normal or unstable hemoglobin seen في post splenectomy mainly في oxidative stress glucose 6-phosphate dehydrogenase deficiency glutathione synthetase deficiency drugs toxins and unstable hemoglobin. You can see it. It's mainly the can في suprafatal stains. You can look it for the shape like a ring. This is a capotranx. This is a ring shape, figure of 8 or loop shape. Like a loop shape or 8 number 8. Reddish usually, purple. Rarely can be seen في pernicious anemia or lead poisoning. Pernicious anemia اللي هو vitamin B12 deficiency. Yeah? This is again Rolex formations. تكلمنا أمس عنها. It looks like a red blood cell like coins sticky together. More than 5 we consider it Rolex formations. Common example اللي هو multiple myeloma. الأذرز تكلمنا عليها أمس اللي هو infections TB high proteins myelofibrosis لكنه commonest example هو multiple myeloma. Agglutinations, this is how it looks like agglutination. Looks like إنك you focus on thick film. You can see it عادة في الويسترن countries إذا كان في الشتاء يكون عندهم شيء اسمه cold agglutinin disease common. It's more irregular, round clumping than linear rollets, seen with a cold agglutinin disease, anti-red blood cell antibody with autoimmune hemolytic anemia, وأيضا you can see it with a macroglobulinemia. Again, this is a blood stem cells. We finish red blood cell morphology. We will go to the white blood count morphology. Start with the blood stem cells. We have myeloid lineage or lymphoid lineage. Lymphoid usually give us lymphocytes. لكن الميلويد can give us platelets, red blood cell أو الميلوبلاست الميلويد lineage في granulocytes اللي هو البيزوفيل والإيزينوفيل والنيوتروفيلز. This is the neutrophil segmented. This is the basophil, usually darker purple color. بنفسجي لونه يجي البيزوفيل. Eosinophil, it's strange colors. You can look it for the cytoplasm. Usually it's orange in shape. So the white blood count could be granulocytic or agranulocytic. إذا كانت granulocytic اللي هو eosinophil والbasophil والneutrophil usually belong to the myeloid lineage. وagranulocytic اللي هو lymphoblast والplasma cells belong to that lymphoid lineage. The red blood cell will platelets through the myeloid lineage. Again, تكلمنا على الميلوبلاست إذا في بيزوفيل وفي إيزينوفيل وفي monocytes وفي neutrophils. We can give it red blood cells اللي هو erythrocytes staging starting from the pro-normoblast وأيضا الميجاكاريوسايتس والبليتس. طبعا الميجاكاريوسايتس it's a precursor for platelets called megakaryocytes. فالميلويد lineage can give us red blood cell, platelets, البيزوفيل والإيزينوفيل والنيوتروفيلز والمودوسايتس. You can see it for neutrophils. This is mature neutrophils. Before that, it's called band. metamyelocytes, myelocytes, promyelocytes, myeloblast. غير مطالبين بحفظ الأشكال هذه، لكن غير مطالبين بحفظ المسميات، لكن مطالبين بمعرفة النيوتروفيل how it looks like. الإيزينوفيل you can see it, it's like orange cytoplasm. البيزوفيل usually it's a black purple colors. This is how it looks like platelets with erythrocytes. This is a lymphocyte. Lymphocyte, it can be the shape, it's closer to the monocyte, like usually monocyte nucleus larger, usually it's eccentric. هنا centric nucleus, هنا eccentric nucleus. اوكي leukocytes normally present في البلد either granulocytes تكلمنا على النيوتروفيل والزينوفيل والبيزوفيل وفيها granulocytes اللي هو الليمفوسايتس والمونوسايت. طبعا المونوسايتس belong to the myeloid lineage لكن الليمفوسايتس it belong to the lymphoid lineage مثلها مثل البلازما cells. What do you think? Polymorphonuclear neutrophils hyposegmented. It could be a hyposegmented. ممكن أحد يقول لي هذا this could be a bands. إذا هنا neutrophils تكلم على neutrophils. غير مطلوب أنك تحفظ لي الباندز، تعرف الباندز لكن غير مطلوب أنك تفصل لي فيها. neutrophil it's enough. This is a platelets. This is another pictures. You can see it bands. Usually abnormal cells, the nucleus, the maturation for white blood count, with time the nucleus will be shrunk and smaller. You can see this is a large nucleus. The ANC ratio is very high here. The ANC ratio is very high here. The ANC أقصد بها اللي هو النيوكليوس للسيتوبلازم. تكون nucleus usually should be smaller than cytoplasm. The ANC ratio هنا it's more. Usually premature cells تكون more dark blue, purple colors. But this is how it looks like the bands. This is the bands. This is bands. This is bands. Terminology, you can hear about left-shifted, non-segmented neutrophil more than 5 means it's increased the bands. This can be seen with infection, viral infection. You can see it bands more than mature neutrophils. This is a normal, increasing neutrophil maturity. This is a normal, segmented neutrophils. This is a mild to moderate, or this is severe left shift. لو تلاحظون this is the bands. If we have لو سمعت terminology اسمه left shifted أو left shift means this is the bands. بدل ما يكون هو يروح لليمين maturations, increase the neutrophil maturity toward the right things, يصير left shift. The left shift عادة it can be increased في الباند. So this means that we have an acute infection. شخص febrile viral infection, bacteria can cause bands. Sometimes we call it a left shift. No one used this terminology recently في آخر السنوات، لكنه ممكن يمر عليكم left shift فتعرف إنه left shift means increase في البانز. Granules في toxic granulations increase the staining density or numbers of granules. This is the granules inside the cytoplasm. Seen with the bacterial infections, the other inflammations. ممكن أيضا تشوف vacuoles with the granules. The GCSF اللي هو we can give it post chemotherapy to post neutrophils count حتى ما يصير في delay. The other name احنا نسميه اللي هو الفيلجراستم. هو النيم هنا هو granulocytic colony stimulating factors to improve the neutrophils count. لأنه أحيانا الكيموثيرابي لما تبغى تعطي النكست دوز بعد 3 weeks 4 weeks ويكون neutrophil count below 1. Sometimes احنا we hold the chemotherapy حتى neutrophil count to be above 1. فأنت to avoid the delay of chemotherapy in some toxic chemotherapy we give it a GCSF اللي هو granulocyte colony stimulating factor أو ال other name اللي قلت لكم اسمه filgrastim في أكثر من اسم له. Anaplastic anemia can looks like this shape. This is a neutrophils لكنه hypogranular أو agranular neutrophil. لو تلاحظون cytoplasm it's poorly stained و hyposegmented أيضا at the same times. يعني المفروض إحنا قلنا النيوتروفيلز تكون 5 loops. Here we don't have it, just only like a bands موجودة و hypogranular. لو تلاحظ تقارنها مع النورمال حيكون في pinkish color في الجرانيوليشنز أو في السيتوبلازم. This is common إحنا we see it with MDS اللي هو myelodysplastic syndrome, hypogranular neutrophil. poorly stain و poorly segmentations. Doll bodies, it's a small, round, oval, pale, blue-gray structures found at the periphery of the neutrophils. واضحة هنا الdots. This is the bands, huh? Dots contain a ribosome and endoplasmic reticulum, seen mainly with a bacterial infection inflammation post GCSF during pregnancy. Doll bodies, it's common to be seen after the bacterial infection inflammation with GCSF or during pregnancy. Usually it found في الوايت blood count مش في الريد blood cell, different من ايش؟ ايش الشيء اللي مر علينا كان في الريد بلاد سيلز كان بريفرال؟ هاينز بودي. فthis is mainly في الوايت blood count مش في الريد blood cells, doll bodies. This is how it looks like. If you find a vacuole, this is vacuoles. الوايتش area vacuoles. This is toxic inflammations ممكن يكون موجودة. The vacuoles أو non-proper preparations for the slides. It can be in a fresh blood smear. Vacuoles looks like. Severe sepsis and infections, again, bacterial or viral. Or artifact with a prolonged standing. You can see the vacuoles in neutrophils. This is a neutrophils, segmented. This is thread-like in between the segments. So this is a vacuoles. White dots. Bulgar-Hood cells قريبة جدا للأجرانيولار neutrophils يسمونها Bulgar-Hood anomaly. It's a benign inherited condition. The neutrophil nucleus failed to be segmented. بتلاحظوا الصورة هنا في pinkish color في السيتوبلازم لكن النيوتروفيل is still like bands. It's not segmented. So this is a benign inherited condition. You can see it. It's called Bulgar-Hood anomaly. Majority of circulating neutrophils have only two discrete equal size loops connected by thin chromatin. In between each others, هيكون في thin chromatin bridge. This is common to be seen as Bulgar-Hoods, which are benign inherited conditions. This is eosinophil. واضحة eosinophil. Nucleus bilobed. Cytoplasm تكون pale blue or orange mainly. الجرانيولز تكون gold or orange. Coarse sphericals. Eosinophilia, you can see it with a prolonged steroid administrations. Allergic condition في asthma people, high fever, parasitic infection, reactive eosinophilia, eosinophilic leukemia, في شيء اسمه idiopathic hypereosinophilic syndrome, T cell lymphoma, B cell lymphoma, acute lymphoblastic leukemia. You can see it, all of them eosinophilia. في زي ما في eosinophilia في eosinopenia. Basophils. This is the basophils. This is the eosinophils, huh? This is neutrophils. Basophils, usually it's rare, less than 1%. Nucleus segment fold up on each other, resulting in a compact, irregular, dense nucleus. Close lotus flower-likes. زي flower-likes. The granules, usually it's large, variable for size, or dark blue or purple. Sometimes it's obscure the nucleus. You cannot determine where is the nucleus here. Increase mainly في CML, chronic myeloid leukemia, وحنمر على chronic myeloid leukemia later on. في الميلوبروليفراتيف أي STEM questions يذكر لك إنه peripheral blood smear show basophilia. Think about the myeloproliferative disorder, mainly CML. This is how it looks like in monocytes. The monocyte, you can see it with the Crohn's disease, tuberculosis, chronic myeloid leukemia, في acute leukemia with a monocytic component, infectious mononucleosis, you can see it monocytes. This is how it looks like a lymphocytes. Usually it's central. Lymphocytes, cytoplasm, usually it's dark or smaller than the nucleus. It's around 20 to 40 of total white blood counts. Cytoplasm pale blue. Large lymphocytes, less densely stained nucleoli with abundant cytoplasm. Few round purple azure granules as presence. Here azure presence, granules. Other things we have to consider lymphocytes. You can see it. This is a lymphocyte. تكلمنا على white blood count. This is the red blood cells. You can like kissing. Other name for reactive lymphocytosis يسمونها kissing signs. تلاحظ إنه lymphocytes kissing each red blood cell around. That this is gives us a clue. No, this is most likely lymphocyte rather than monocytes. This is the reactive lymphocytes. You can see it, kissing sign. Have a slightly large nucleoli with open chromatin. Chromatin was open, abundant cytoplasm, seen for infectious mononucleosis or viral infections. This is a kissing signs. This is a malignant lymphoid cells. The best example for this, it's a CLL, the chronic lymphocytic leukemia. لو تلاحظونها يسمونها السكر بول. لو تتذكرون كرة القدم القديمة جدا اللي تابع أو يتذكرها قبل 15-20 سنة في الحواري تكون بالشكل هذا قريبة من الشكل هذا. It's called the sucker ball pictures. Commonest example هو CLL. chronic lymphocytic leukemia والother name اللي هو السكر بول lymphocytosis. ركز لي على السكر بول lymphocytosis. Platelets. We finish from white blood count morphology, then we'll go to the platelets. Platelets, normal counts between 150 to 400. Non-nucleated cell, which usually derived from megakaryocytes and originally derived from myeloid lineage. Has a purple red granules. You can see this is the stem cells, how it's developed that way for platelets. And then we have it a megakaryocytes, large, mega mean large, karyocyte. Then how it looks like later on, non-nucleated cells called the platelets. This is the platelets. Thrombocytopenia means decrease in number of platelets. Decrease in numbers either due to decrease in productions when we have aplastic anemia, acute leukemia, viral infection, parvovirus, CMV, or increased destruction of platelets إذا كان في immune thrombocytopenia أو idiopathic thrombocytopenic purpura أو neonatal alloimmune thrombocytopenia, disseminated intravascular coagulations, or hypersplenism. All of these can increase the destruction of platelets, وبالتالي the end result will be a thrombocytopenia. في another terminology ممكن يمر عليكم اللي هو pseudo-thrombocytopenia. مريض نومته عن طريق الطوارئ اليوم البليتلتس كانت 230. تنوم بكرة عملت اوردر CBC كلمك اللابس قال platelets was 15. أول خطوة تعملها you have to look it for your records. كيف كانت البليتلتس قبل كذا؟ أمس كم كانت قبل أمس؟ فإذا كانت normal you have to repeat it في saturated tube لأنه أحيانا يحصل clumping للبليتلتس في الإيديت تيوب. فأول خطوة تطلب saturated tube لأنه يحصل ما يسمى pseudo thrombocytopenia. due to clumping of platelets في الإيديت تيوب تحتاج تعملها في saturated tube. If it's still low then you have to investigate. لكن usually if it's pseudo thrombocytopenia platelets will be normalized again. Thrombocytosis في reactive thrombocytosis وأقرب مثال هو الأيرون deficiency anemia. You can see it بوست سبلينكتومي. المرضى دائما الجراحين اذا عملوا سبلينكتومي يكلمك بعد 3-4 اسابيع يقول لك والله جاني المريض فولو اب platelets goes up to 700. This is simple reactive thrombocytosis. You don't need to take any action, just only watch and wait. Post infections, inflammation, juvenile rheumatoid arthritis, collagen vascular disease. في another category it's called AT اللي هو essential thrombocythemia، وهذا تبع المايلو proliferative disorders وراح نتكلم عنه لاحقا. essential thrombocythemia وعادة البليتلتس تكون more than a million، يعني in between million and 1,500,000. لكنه reactive thrombocytosis, post-splenectomy, iron deficiency anemia, post-infection, inflammation, all of them can cause thrombocytosis. This is the platelet morphology. It's called giant platelets. This is the giant platelets. Platelets seem to be a size of red blood cells. We can be seen with May-Hegelen anomaly, Bernard-Soleit syndrome, Albert syndrome, storage ball syndrome. This is a peripheral blood smear. Collectively, you can see it. This is, what do you think? Different shapes of white blood count here. ايش اللي امامي هنا يا شباب؟ ولا تبغون اختار باسم؟
النيوتروفيل.
This is a neutrophil, excellent. هنا
الليمفوسايت.
lymphocytes.
هذه كيسنج lymphocyte.
reactive.
reactive. هذه eosinophilic.
What is this?
basophils.
هنا monocytes. Okay, this is the neutrophils. واضحة؟ ملاريا، واحدة من البريفرال سمير ممكن تلاقي بملاريا. Plasmodium falciparum, erythrocyte throughout the serous are not enlarged or distorted. Early trophocytes. This is a call for موجود هنا. هنا banana shape الجاميتوسايتس في الملاريا. أحد الأشياء اللي ممكن تشوفها تحت البريفرال بلاد سمير اللي هو الجاميتوسايتس أو تروفوزايتس، خصوصا في البلازموديوم فالسبرم. لو تلاحظ looks like a ring. هنا. So this is a trophozoites early or يسمونها a call for. Again, it's double chromatin dots, ring 4 with early trophozoites or a call for. This is an early trophozoites in the form of thick ring with a large chromatin dots. Leishmaniasis, Leishmania Donovan bodies. This is how it looks like Leishmania. African trypanosomiasis, how it looks like African trypanosomiasis. This is a parasitic infection طبعا. We can see it through the peripheral blood smear. American trypanosomiasis هنا الأفريكان، وهنا كروزي اللي هو trypanosomiasis. This is microfilaria. أحد يعطيني المين كوز فور microfilaria medical condition، إيش سبب لنا الميكروفلاريا؟ يا أهل الميديسن، مر عليكم any medical terminology أو disease due to microfilarial.
لا دكتور ما بعد
ما
درسنا.
اتوقع ما اتوقع هذا
معقول
انفكشن.
ما مر عليكم في الباراسيتيك انفكشنز؟ اخذتوا باراسيتولوجي؟
لا ما بعد درسنا الانفكشنز في الميديسن، مر علينا في البري كلينيكال بس نسينا يعني.
مر عليكم في البري كلينيكال بس نسيتوه. في احد يتذكره؟
لا والله يا دكتور.
طيب elephantiasis can be caused by microfilaria. ها؟ elephantiasis ارجعوا له تلقونها. can be caused by microfilaria. انتهينا المحاضرة الأولى الساعة 2 الآن. نبدأ في المحاضرة اللي بعدها.
ناخذ بريك دكتور.
طيب كمل بريك.
5 دقائق اتوقع تكفي.
طيب تمام. إذا نرجع للساعة 2:10.
تمام الله يعافيك.